Medical Monday. Dr. Medov joins us now. We are talking about atrial fibrillation. Explain what this is for us.
So, Cassandra, atrial fibrillation really is the most common rhythm abnormality of the heart. Okay? It's an abnormal heart rhythm in which the upper chambers of the heart, rather than beating rhythmically like this, start fibrillating like this, almost quivering or fibrillating.
Is it serious?
It can be very serious. You know, there are a lot of different things that can happen because of atrial fibrillation. You know, a lot of patients, feel palpitations. Sometimes, surprisingly, a lot of folks don't feel any palpitations, and it can present very insidiously, like, you may start feeling tiredness and fatigue, and it can lead to damage to the heart. It can lead to heart failure. There are a lot of things that can happen with atrial fibrillation.
Let's take a look. Let's talk about some of those symptoms again, just in case people are at home wondering, could I have this? Do I know somebody who have this? And like you were talking about there, the racing and the fluttering of the heart, and like you said, fatigue. What are some of the other things?
As they're listed over here, racing, fluttering, you can feel that. Fatigue is one of the most common things. And honestly, the fatigue can get worse over time. The other thing that can happen, is, and it's been identified more and more now, is heart failure. And one of the biggest risk factors with atrial fibrillation is stroke.
All right.
So, you can have heart failure, you can have stroke, you can have fatigue, you can't do anything. So there are a lot of different things. And, the best way to kind of diagnose it is, sometimes people can feel their own pulse. If it's irregular, they may be having atrial fibrillation, but there are a lot of other things that can cause irregular heart, pulse. But irregular pulse can tell you. A doctor can listen to your heart, and they can feel the irregularity. But really, the gold standard to identify atrial fibrillation is an EKG. Or an electrocardiogram.
So that's why it's so important to talk to your doctor and have that open line of communication with them, just in case you're not feeling right. Okay, and then at that point, the EKG is the best way.
That's correct. And an EKG is a simple test. It's a non-invasive test. Just put some stickers on your chest and get it done. Any primary care office can do it.
And that's mainly, peace of mind is so important in this. Absolutely.
And even more, peace of mind is important, but I think even more relevant is that if you do have atrial fibrillation, the earlier we diagnose it, the easier it is to treat. The later we diagnose it, the tougher it becomes to treat.
So if you don't feel well, get in and talk to your doctor.
That's correct.
All right, thanks so much for being with us. For more information about all of this, including all of those symptoms, just visit our website and click on this story. Well, chewing, slurping, chewing gum, smacking, all of these sounds